Hi, good morning. My name's Jeremy Lewis,
And I'm Peter O'Sullivan.
and we've just finished a seminar at the WCPT here in Geneva based on an editorial that we wrote together last year, published in the British Journal of Sports Medicine, on the myth that we can fix people who have got persistent musculoskeletal pain. We were very privileged to be able to run the seminar, and we had some great presenters who will have a couple of them coming together in this video. So maybe Pete, you'd like to start and just tell us a little bit what your thoughts were about the seminar and the main themes?
Yeah, so I think one of the key things that we know from emerging research is that musculoskeletal disorders are like one of the greatest, is the greatest burden disease of all health problems. We've got escalation of disability associated with it and increasing costs. So we have a health system that is providing what is known as low service or low value care, which is often risky, expensive, and doesn't result in great outcomes. And unfortunately, those services are funded. And in spite of the fact that there's emerging evidence that high value care looks like addressing some of the drivers of pain and disability in terms of empowering people to take control of their health, to address things like inactivity, obesity, fear of movement that often comes when we scan people and tell them that their body's damaged, because we know that many of the things that we see in a scan are normal, but we're redefining them as damage. And I think what highlighted in the session is that we have a very wicked problem. We've got vested interests that are powerfully influencing the way health resources are promoted. We've got a workforce that is being told and has an expectation to try and fix the problem. And so there's a lack of confidence, I think, within the health professions to provide high value care around self-managing pain. And then we've got siloed healthcare as well. And so we've got so many different factors, and I think the beauty of that within the session is that we were able to draw on people from education, from industry, from health industry, from other aspects of healthcare to kind of explore that, and we'll have an opportunity to kind of cue into some of those key thoughts on this session.
And I think that's a great summary. And one of the other features, we both presented our journey to the seminar from the start of our career. And we both qualified as physiotherapists at similar times, and we spent the early formative part of our career both working very hard to educate ourselves in manipulative physiotherapy and sports physiotherapy and biomechanics to be the best fixers that we could be for patients. So a person in our society that we were offering care to would come in, and we would do the very best we could to identify the problem, the biomechanical problem, and try and fix them. And then we both went through a journey where we realized that maybe it was more empowering for the community, the health communities we were serving, to actually try and become enablers or empowerers of people to help them So we would provide education, advice, work together, as Pete was saying, with different members of the health team, but to try and provide the very best self-management possible.